Welcome to MMS Research, your sexual and reproductive health expert. Are you a couple who wants to conceive, or equip yourself with the knowledge of fertility, or you want to know the contraceptive advantage of tracking your cycle, or maybe you want to know safe and unsafe days? Then, this fertile window concept is for you. In this video, we are going to discuss the fertile window and menstruation cycle, including the key events involved in the process. Welcome. First, the menstrual cycle is a complex process regulated by hormonal changes, typically lasting about 28 days on average, but it can range from 21 to 35 days. Here's an overview of the key events and phases, along with the concepts of fertile and safe days. The process begins with 1. Menstrual phase, days 1 to 5. This phase marks the beginning of the cycle. The uterine lining, endometrium, sheds, resulting in menstrual bleeding. This occurs if there is no fertilized egg implanted in the uterus. The shedding of the uterine lining is triggered by low levels of estrogen and progesterone hormones, which results from the disintegration of the follicle that released the egg. 2. Follicular phase, from days 1 to 13, follows. This phase overlaps with menstruation and extends until ovulation. During this phase, the pituitary gland releases follicle-stimulating hormone, FSH, which stimulates the growth of ovarian follicles. One follicle matures and becomes dominant, hence preparing to release an egg. This growing follicle secretes estrogen hormone, which helps rebuild the uterine lining. 3 is ovulation phase, day 14, in a 28-day regular cycle. In ovulation, the mature egg is released from the dominant follicle in the ovary and travels down the fallopian tube. The hormone involved is luteinizing hormone, LH, from the pituitary gland, where its sudden increase triggers ovulation. Fertile window refers to the days surrounding ovulation, about days 10 to 15 in a 28-day cycle, when a woman is most fertile. Sperm can live in the female reproductive tract for up to 5 days, so intercourse during this period is likely to result in pregnancy. 4. Luteal phase, days 15 to 28. This is a post-ovulation phase. After the egg is released, the empty follicle transforms into the corpus luteum, which secretes progesterone and some estrogen. Progesterone hormone prepares the uterine lining for the potential implantation of a fertilized egg. In case of no pregnancy, that is, the egg is not fertilized, the corpus luteum degenerates, leading to a drop in progesterone and estrogen levels, triggering the start of menstruation. So, which are the safe and unsafe days during the cycle? Unsafe days is the fertile window. Typically, days 10 to 15 in a 28-day regular cycle are considered unsafe if trying to avoid pregnancy. But when you want to conceive, these are the days you should have regular intercourse because it is when ovulation occurs and the chance of fertilization is highest. Safe days, generally, days 1 to 9 and 16 to 28 are considered safer, but this can vary based on individual cycle lengths and regularity. It's important to note that tracking methods like the calendar method can be less reliable due to cycle variability. If your cycle is regular but not 28 days, you can watch our video on how to calculate your fertile window and learn more. Thanks for watching. Kindly don't forget to subscribe to this channel for more videos on sexual and reproductive health.